Thank you very much for the invitation. I see the golden heads here, or silver heads here, and I want to recognize my friend Oscar Feo, whom I knew in this our life going here and there in the AIDS fight World Fund, and my colleague Marta here. Yesterday I felt a little like the fly in the milk, because the important thing in this presentation that I will make is to tell you about me in order to know where I come from and understand why I am here and why I'm doing what I'm doing. I have been 20 years now working in organizations, 2 years in the World Bank, in Eastern Europe and Central Asia, 3 years in the IDB in Central America, and 5 years with Bill Gates, 2 years in the World Fund in the fight against AIDS. So when I yesterday heard what I heard on one last, I was laughing, on the other one I said, I am a fly in the milk. In these 2 years, I was 4 years in the government in Quito. During the Gaviria government, Ministry of Health, Secretary of Health, with 27 years of age. That means to say, I am not a sweet fly, as you may see. All that experience has taken me in my 50s to see what I'm going to do in the rest of my life. And in those organizations that I work, I learned a lot of things about personal conduct and vocation and patience that I learned in the Gates Foundation, because I consider myself, as Ricardo, devisor of public policy. I am fanatic of local public heritage and goods. I am very, very involved with favorable development in public organizations. But what motivates myself, in addition to the invitation, of course, is that in the Gates Foundation I discovered, for me, the most important thing is to contribute, help, mentor people like you, who are the experts who are replacing the older generation. Although I don't have it here, I see it as it is. So this is what makes me stay at the university I am today. Therefore, I am not going to refer to the best practices if there is time enough. Ask me why I don't believe in that, if you don't get it from my presentation. But it's important to know about the lessons learned. I work in a laboratory, which is the social system is a laboratory. And the methodology that we use in the laboratory are the ones to be presented now. It's going to be a methodological approach, which very clear indeed, and in my presentation, and I will show 2 cases, one from America Latina, and both are underway, and the other one on the INA. And I hope to leave a lot of questions so we can discuss and debate. I don't know if these methodology are applicable to your own contexts, but something tells me that yes, that they may. This is the content now of my presentation. There are some theoretical information. You have the reading material, an article from Grau. I found one in 2014. I'm going to send it. It's excellent. And I am going to address some of her items in this conceptual framework. I am going to make an introduction to the complex and system dynamics, Yesterday there was a marvelous introduction by Pena. I thought I was going to find problems in this area, but he opened the context, and at the end, I will make very modestly a presentation, a succinct presentation on the manner of thinking in a national or ecosystem in the intersectoral action. Of all the topics that you are addressing, integration of public policies, intersectorality, intersectoral actions, social determination of health, social determinants of health, equity, promotion, right to health. If there is an important characteristic, is that there are not unique definitions. In the concrete case of what I'm referred to, one of the reasons for which I have to, it is difficult to speak about best practices because the ambiguity is so great, but it is difficult to say this is the best practice. But we may say that in a specific context, with the following characteristics, social, economic, and so on, you are doing this manner, and the results are these. This is the change theory I have in mind. So, therefore, Dr. Pena mentioned yesterday about complexity, and I will translate it into a topic that I love, which justifies intersectoral action. But intersectoral action is carried out according to the context, but doesn't guarantee the resolution of this type of problems. And these that you see here are examples of these problems, and this on a global perspective, because that is my world in which I work. But each one of these programs has some type of representations in each one of the countries and in the districts in our region. Not all of them are going to be the same, of course, similarly severe, but they are complex. Some of them may be perverse also, because they do not, because there are multiple causes, no sector can resolve them by itself, and when we have public policies to face them, sometimes the remedy is more harmful than it is imagining. Unexpected effects, I would say. I will explain that. This is one of the things that I selected in my university in order to have a program that, as Alessandra said, is a translation about what the basic scientists are doing, but taking it to the communities and everywhere in the world. And I'm going to use that approach because I think it's very, very practical to illustrate what you're doing. This is a typical case if you are a nutritionist. If you see this program of malnutrition from this perspective that Pena mentioned yesterday, or if you are a physician, but according to what we heard the rest of the, if we are a thinker in intersectoral action, this is not only a medical problem. That the problem of agriculture is not a problem only of the land and of the production and the seed, but also of genetics. So if we add the hidden hunger and the deficiency of micronutrients in this sphere below, the tradition, the monodisciplinary tradition, we find today experts in vitamin B12, in zinc. We have to add zinc to diarrhea treatment because it's sufficient for this treatment, but we become obsessive with zinc. And the point here, which is the main objective that I bring in today, as far as I understand, is how to integrate the public policy response in order to face and fight, for example, this challenge in such a way as to have good results, but also to attack social determinants of health. Now I am speaking about determinants and not determination. Yesterday we also heard about, Dr. Pena mentioned the cognitive structures, and we know that they are filters of reality. And when we are working in just one sector, we bring those filters within our sector, and sometimes this complicates coordination and communication within the sector. But when it is intersectoral, the debate, discussion, dialogue, and all this, we have different filters, and this is a mental model with some complicated obstacles in order to communicate. So I invite you to read that phrase. The leveraging points refer to those places within a complex system, a corporation economy, a living body, a city, an ecosystem, where a small alteration may produce great changes in the system. The author published this book. They use a modeling system in terms of system dynamics, which was brutally attacked. It was attacked by the right wing, the left wing, up and below. The book showed that 50 years after, it has been demonstrated very clearly that economic growth, without limits, by itself, was going to put the environment at a risk, a very high risk, creating retrofitting cycles that eventually could contribute to the economic fall, economic decrease. Why is it that they used indicators, this and that and that? Because the formula didn't include how is it possible that you can think of an exponential coefficient. That was the discussion 50 years ago. The book was attacked. One of the reasons, I believe, is that, in fact, the methods used were unknown at that moment. And secondly, as we heard previously with Ricardo, we tend to go to the evaluation methodology we know, and which at present, in the randomized control trial is the golden rule. This is completely different, and this I will address now. I am interested in my work as a person that works in public policy to identify in any complex system which are the leverage points or the leveraging points that nobody may know. If I am an expert in public health and I am speaking about malnutrition, I will say, the problem, I mean, in my mental model, are the micronutrients or zinc. Or if he's an economist, no, it's a problem of sense. If an epidemiologist, well, are the factor of risk that we haven't been confident. Each one of them will bring to the options of policies his or her own ideas on which is the best leveraging point or supporting points in order to help the system. And this regulator doesn't work like that. Then you will see these three disciplines: public policy, public management, which address the implementation of public policies, governance theories, and I will give you 2 examples of this with a quick introduction to the theme. I told you where I come from, but it is important that everybody doing this kind of presentation, we have to leave our personal seal very clear. You see mine on in the slide. And the methodologies and approaches that I will be using, I will be very happy for you to ask me which they are. This is very important, lack of actualization regarding the public reality of South America. I would have liked to tell you more about what I knew before from South America. But in 5 years, things change a lot. I told you where I come from. The organizations I have been working for. This reference that you cannot see, but you will see in the slide deck, is an adaptation that I made of the most recent version, 2014, of an article of Esta Dama con el Grau. The people from Chile will know her, which is one of the two authors recommended for reading. I liked it because she focuses intersectoral action, which is not the same as intersectoriality. One thing is to discuss among sectors, and the other thing is to translate that dialogue in actions and implementation, assessment, and result.
And also, I think that it's very important also the differentiation she's making between the disciplines or rationales that operate on collective action and also the public management and intergovernmental relationships. They are very different. I would even say, well, first, this here, up here, as you can see, refers to things like PPPs in the issue of partnerships in general, public partnerships, and intersections with different sectors and wholes here. They have an implication in a rationale. Was this type of work also tries to produce a certain type of change, obviously improving the performance of organizations. There's a world of inter-organizational networks, and the rationale is technical. It's a rationale of effectiveness. We are getting together to do something in common in order to improve something that is of our interest, and also which is our very own capability of improving. Even though it can be translated into a political discourse, essentially it has a rationale which is not political, but this here, actually intergovernmental relationships, public management, the search for integrality that Ricardo described brilliantly just this morning. This is a political rationale, as he said it himself. Also, they're done because it's a principle of the government, of the party, and they do it by, this is being done by different parties and administrations. Now, one of the most interesting things in Latin America, as I have found, is that in some countries, they're articulating this type of intersectorial action because it's been found that integrality of public action can produce actually substantial solutions, whether very variable, substantial solutions for the complex problems and evil problems that are faced. This type of action produces public assets, public good, that will never be produced or would never be produced by this type of partnership, where there are other types of actors with the political rationale, the one that, or the political argument, see these problems. Otherwise, the private sector, for example, by itself, will never pay attention to. I do recommend reading this excellent article. As Ricardo just said before the break, there are pending questions for integration of public policies, for action, intersectorial action, the translation of the decision of policies in implementation, outcome assessment. We have this type of questions that are here. And I found very little literature. One that caught my attention is the case of the Workers' Party, Labour Party in the United Kingdom. The Labour Party in the United Kingdom, the last time that were held government with Mr. Blair, the Labour Party in the United Kingdom won the elections with a platform in which partnerships, interagency partnerships in English, were the structure, the governance structure, the preferred system for the provision of public services in the health sector took this up as a mandate. There's a wealth of information also in terms of evaluating this experience that would feed, from my point of view, the issue of intersectorial action, but this is in England. No, this is not in Latin America. There are two or three things I would like to share with you now. First, the political mandate. There was a political platform from the Labour Party in the United Kingdom. Secondly, the same government this is what is shown in the assessment in the execution, is it used management models that were contradictory, and they were changed actually very frequently, so the actors of the system were working in a new and complex fashion and at intersectorial level, and they were submitted to a change of the rules of the game and new structures and a new committee all the time. That possibly will explain the reason why the impact assessments do not show outcomes. What they do show is a trend to the creation of new structures. We are going to set up a committee. Is something that occurs around the world, supposing that when having a space for dialogue, with this, action will be generated. What my colleague Nadrao actually states clearly and brilliantly in the case, especially of Chile, with what she analyzes, but she extends this to the rest of Latin America, where she finds data, is that this is our phenomenon too. Believing that intersectoriality is the preferred management model, the intersectorial action derives from interaction of the different sectors. When we're seen in reality is action implies into thought in planning, in assessing, and follow-up. I believe that in some of the things that Ricardo said this morning, we see some of the challenges with the challenges of forced integration, or these are the risks too. And in the third point, literature shows us, and this has to be highlighted, is that there is no better practice if we do not wonder what is the challenge and under which context there are certain types of intersectorial actions that are effective. This question has no a priori response, and it's important, at least from the action and research viewpoint, have to be understood. Just to give you an example that was mentioned in these 2 days, depending on the decentralization focus in your countries, be it fiscal, political, and administrative, there will be different combinations of management models for implementation or implementation models. I think that one of the things that would believe that are in the literature could be perhaps better assessed is some examples that you have given and that Ricardo gave this morning, showing intersectorial action at the decentralized levels is usually more effective in terms of what being assessed or measured. But this cannot be generalized. There's no sufficient information. At global level, at world level, we have been listening to these two first ones. This third one of the problems, of the wicked problems is in New Zealand, in Australia, in United Kingdom today, and others, to these ideas of holistic administration, which is closer to what Brazil is doing with the definition given to integrality. But it's not just that. If you want to read it, in our region, as you know, these strategies for poverty reduction and social protection have been part of the fuel and energy that give motivation for intersectoriality. A few steps are still needed. Which are those steps? I cannot say them, but this difference between the political fundaments, technical fundaments, I do not raise it as a dilemma. There are two visions, different visions of intersectoriality. I copied this verbatim from the article of 2014 of Kunil Grau, and you're not going to see clearly, but just yesterday, Oscar introduced actually an ideological continuum in wild markets on the other one side. I'm not just talking about the other side, but it's a continuum. It's not a dilemma. In the case of intersectorial integration, especially of the type of action and the type of management model to be applied, we can start by collaboration. We can go to convergence and then go to consolidation, but end up in integration today. Ricardo talked to us very well about this point, but I bringing it to your attention. You can read it when you have access to this document, because there are other alternatives. There are different levels of action at intersectorial level. They're not excluding among each other. There's no linear relationship. You can start from one and go to the other. And in a specific municipal context, perhaps the most you can do is intersectorial collaboration. At national level, actually what Brazil is doing is heroic from my point of view. Ideologically, I applaud them, which is integration. I am for integration, but it's very hard. It's wonderful what Brazil is doing, but it's not the only alternative. And I would suggest that the course should look in depth into case studies so as to see examples of failure and success of some of these examples. They do exist in literature. Perfect. Now, and with this, I finished my theoretical part of the presentation. It was hard for me to understand all of this, once again, as a continuum amongst us and amongst any, actually, legislators or policy designers. We can have, these are not mental models, but they're archetypes. We can we come from Weber's architectural system, in which the metaphor, or be it the narrative, is to implement things, cause execution. In fact, the key word is control. The metaphor is a machine, and it's typical of public traditional administration, and in any country. Still, these things are being done differently in some countries. We see the characteristics here. You have very well defined, actually, rules of the game. Their standards, actually, their standards. Oh, the Ministry of Health has standards, norms, and the norms are the ones that maintain the hierarchy in control. They maintain the power within these silos that are created always when using actually hierarchical process. Actually, what you see here, this is of modernity. This is early 20th century. Also, you were born in the last 25 years. You were a fanatic of Facebook. If you believe in the social movements, you are on this other side. It's a focus which is actually let things happen, allow things to happen. Actually, we see there's no notion that there is one thing that is control. I don't control anybody. Nobody controls me. In this world of letting beat be, the metaphor is of the social movements, of ecosystems. The actors are different, are dispersed and scattered, but they unite, and when they unite, they have power, wonderful power. Somebody told us yesterday, who was it? Paulo. Going to be able to do government, but a government, they should be activist. We need to be able to mobilize this type of forces. And it's important for us to understand these are dynamic ecosystems. Just like there are species that appear and disappear, these movements also might be transitory. There's a way of studying today, very interesting, of what happens when they're evolving, what happens with organizations within the system. And number one, for example, is the one that really is the one that I personally, actually, is my philosophy of life, which is actually support things to happen. I cannot control the system. I refuse to leave it actually just a good luck, but I have to find a way how I mobilize connection between people and organizations, uniting actually birds from the same feather or not on arrangements, organizational arrangements that can be formal or informal. This is a world of social networks. Those who are who studied anthropology and sociology so know it better than I do. Well, I have to be swift. Everybody knows what a system is. Elements that interact also with the context. And the context changes, but the context changes, but the context is changed. Also, a system turns complex in the case I put, well, actually, an idea where there is a community, where there are social standards, for example, with it's the role to be played by women, the level of education of girls. We have households and there are women in reproductive age that demand services from the public health system. Within the context, actually, defines, for example, the structure of the community, the social standards, the political conduct. But in this ecosystem, their goals, the system actually exists, and also their limits is a structure. There are some flows, and also we have feedback flows. We have studied that in our lives. Let's pass through this. Perfect. This is very important. In public policy, when we try to resolve complex problems like the ones that I mentioned also, we normally forget that when we enter into a system to try to change it, the system already has a pre-existing structure and has a balance. History, politics, definitely Oscar, this the opposite of the other idea. Yes, history is at the basis of the structure of the operation of the functioning in the cycles of the system. Yes, there are cycles that are positive, that due to the accumulation of events in time, of delays, of the sequencing that Ricardo mentioned in his presentation, I introduce a policy, we introduce a policy, better said, but there is a phenomenon of interaction within the system that is going to be producing this type of effect, despite what I might do. For example, if this is inequality, inequality will be still accumulated for some time. And you see that there's a hike. We have accumulation of income in the last years, whatever, produce a hike. If you want to see a negative balance, you see a negative balance, and in this case, regardless of what I do in public policies for the whole period of time, this system, imagine this is the rate of poor people in the country, poor women, regardless of the policy that I introduce. Throughout this period of time, this system is captured in such a way that won't be able to, the women won't be relieved from the cycle of poverty. So what the dynamic systems tell us is that make sure that you think in what is occurring within the structures in the system that maintain these vicious cycles, and sometimes this negative and this is positive, ones that not necessarily are favorable. These are favorable, and the other ones are unfavorable. This one here, for example, imagine this is an ecosystem, and we have actually preys and predators. It's not good, neither bad. This is capitalized such because the preys are eaten by predators when there's, and where the level of prey goes down, the predators start dying. This is a negative cycle because it maintains the balance of the system. The system doesn't change. Today, there are 3 research methods. I'm going to be talking to you today about this one and that other one too. Social networks, I said it already. This called agent-based modeling. I don't know how to translate this into Spanish, he says, but this is used in political science because essentially, actually, the simulates is the behavior of different actors. Their interest, the generation of confidence, mistrust, is supremely interesting in social sciences.
social networks simulate and identify and intervene in interaction among human beings and organizations. And this is the dynamics of the system. Is very useful in public policy because helps to identify cycles, positive and negative, that maintain a system in such a static queue that if we identify them, may identify where the system is leveraging to change it, leaving stability behind. There is a Brazilian film, Forza de Lici, is a very violent version, and also Hollywood film, almost a Hollywood film of a system, of these dynamic systems that perpetuates inequilibrium, imbalance, and all the acts of different players, the good policeman, the good mayor, the corrupt policeman, and the drug trafficker, all the acts, although they have good intentions or not, produce more harm to the system, and the system continues with the crosses, with poverty, drug traffic, and so on. This is a very funny study to some extent, but it's very seriously taken. When we see a system, when we speak about a system, what we really can see, this is a word by Jackson Pollock, system is not visible. What we can see and we can think, let's think that this is a very highly practical theory for us, are indicators and data. This is what we see, that we can measure. And our purpose, objectives, is our discourse. We have some objectives, we can see the indicators, obviously, among the objectives and the change of the system. There is a gap, there is a problem that we have to resolve, an action plan. We implement it to see, sometimes we use empirical evidences in order to plan the action. We try to change the system, we measure, and we believe that we are seeing the system, but what we are seeing is just this. The greatest problem is that you all of us that are working in public policy, when we have a police objective, we know the problem, we know the plan. The reality is when there are complex problems, as in the case of equity, we don't know how to intervene in the system. We have theories. We have no other disciplines that say, well, when the problem is this, I learn to do this and this and that. But the reality is that as we cannot see the system, our action plans are always not perfect. And when they are monosectoral, and when they are intersectoral and they go through the shared process, this doesn't mean that the plan is empirically better or the best. It is socially instructed, therefore it is more valuable from a political viewpoint. In order to come from this ambiguity, we use modeling, we use models. And Marta's question on evaluation assessment of integrality in Brazil is subject to a model without having impact assessment, because these are known data, which are those. Or in order to have the model that John mentioned yesterday on equity, it's very easy to have a conceptual model to validate socially what kind of action could equity implement. So I'm going to give you two examples. Look at this. Those who have studied social sciences know that, including economics, when you in public policy try to face a problem, we can do it from different approaches, and these are different disciplines. And when we refer to the, when you start in the epistemology of the intersectoral action, there are four complementary approaches. None of them is sufficiently It's sufficient to understand how I am going to change the system. In the first instance, what we call learning is a perspective of change in which people decide that they are going to be different, what are they not going to do anymore because it was inadequate. This only requires people to see the system in which is interacting is an intersectoral action system in this case. I understand, perhaps I understand better my health system, but when I'm speaking about health integration, education, agriculture, nutrition, food, and so on, this is impossible for a human being to see it, understand it, because working as a group or in communities, we can have system dynamics to invent conceptual models for people to discover, oh, this I didn't see before, this interaction, interdependence. Oh, this is going to accumulate throughout time. If I sequence in this manner, perhaps I may not obtain the result desired. So, not in 4 years, it will take 25. And secondly, it is harder in quantitative terms. This is the less quantitative. The second one is, okay, I have a model, I understand the system in which I am, but I don't know what to do, how to agree, different players. There are thousands of options in policy, so we need consensus on the problem that may be resolved through intersectoral action. The third one is analysis. And here I am here, or I was here, when I studied public policy, because everything was analysis. As an economist, I needed regressions, econometric analysis, I needed all that. But analysis is not justified as a way, because you may resolve many intersectoral problems with very simple things. For example, approaches without needing a very, very complicated model that will take years, that is costly and so on. But if you wish to know which are the leveraging points, you cannot leave that to the personal opinion of the participant. This is an empirical question demanding a response. So my question, which are the cases that you have on the causes of the phenomenon that you are describing? Without traditional studies, we cannot respond, but having a modeling process, we could perhaps answer it. And the fourth one is the system is broken, doesn't mind if I discover where to intervene. The rules of the system, the structure, the interactions are broken. Oscar said, what do you think about China? I'm terrified in China. While capitalism, in the case of the gringos many times ago, was a completely broken system, with new rules are necessary, regulations, and so on. I'm gonna give you very quickly to see how it looks. This is, in the case of Honduran, we work with people from the Ministry of Health, all in the Ministry of Health, but of local level to the central level, with mayors, with workers, the local level, until the Vice Ministry of Health. We have been working in this for 2 years now. This is an approach that says, okay, we have to help these people to identify that they are within a system. This is a group work in 2 days, in a couple of days, and people are presented with an imperfected model. This is a bad vaccination model. And people, students, or communities, or health workers discover the errors in the system. And when they do this, the errors in the model, they start to relate the structures in their own system. This is a very simple pedagogic methodology that doesn't require a computer. Usually we do it with a flip chart, doesn't require an arithmetic equation. Now, once they see the system, they start to say, my God, I hadn't seen that. I didn't know what my neighbor was doing. Now I know that what they do or don't do affects maternal mortality, which concerns me. So in this case, which is the problem of maternal mortality that they have to resolve? And they found something they couldn't see in public, which is, as a country having decided that all the women will give a birth in institutions, and that an institution has to be hosted, but 50%, 20 years after, the maternal mortality fell, but 50% of the birth take place in the private houses. So there is nobody to help these people, and they die at home when they are giving birth. So this model helped them to see this 3-point and say, my God, we have a problem that we hadn't perceived before. Finally, this is not understandable. This is a simulation model with data and information in which the question is, if we had to intervene to change that problem of those 50% women that continue to die, I insist, if you ask me to an expert in maternal health, this is very easy. Let's build hospitals. Before that, I worked a lot with Honduras. This model shows that if Honduras fills the country with nurses, physicians, the mortality will go down marginally. And this model also shows that something they have abandoned or haven't done, because this is the kind of action, intersectoral action, that becomes the political option for maternal mortality in Honduras. Read this, please. In the area of public policies, the collateral effects are not a characteristic of reality, but a sign that the borders of our mental models are too narrow, and our horizons, temporal horizons or time horizons, are too short. And this gentleman, Sturman, says that if collateral effects don't happen in reality, they are a sign that the barriers of our thoughts, of our mental structures, are too narrow and our time horizons are too short. Again, Bill Gates, for example. I admire him. He's impatient, an impatient person. He wants a positive change now. And I understand that. For example, as Ricardo said, one of the synergies. Synergy. This is something in which Gates believe a lot. An intention for synergy providing me more social results in a shorter term. And this doesn't happen like that, because there are those negative and positive cycles that maintain a system anchored in just one place. So intervention, I see, doesn't affect those cycles. They change a structure, they have a new minister, create financial incentives, and a new committee that doesn't work in the structure of the system, and sometimes it is harmful. This I show you. So very quickly, this is the political party in Honduras, what they are doing now, maternal houses, but this is the problem that they have. 50% of the childbirth in public rural areas happen in community. This is the real problem. And the vision of the minister was too sectorial, and this could be very good, but it isn't enough. So this is what we did. I'm going to show you in a picture. This is the director of the lab where I work. We use this vaccination model, and the people very quickly said, this is not good, and no governance, no demand, what is the supply chain? And with that, they themselves. This was the vice minister 2 years ago. And here we have the vice minister, uh, the new vice minister, and they decided, no, the problem that we have to go to the 3 delays. Where are women that end up by dying? And they discovered they were in the communities, they prepare a simulation model, all that drawing and equations and hard data. You simplify saying that in this system we have reproductive women, pregnant women, hospitals, clinics, and so on. And we can intervene. These are the different interventions within the system with the borders they have, which are sectoral borders. And you have an idea, for example, although they are not in order of priority, this is the model shows that the family planning has to be increased, also building of hospital, but the people working with maternal mortality in the Honduran ministries are not thinking in family planning because that is the job of another sector. But when they together and when we saw it with numbers, it changed. And here the important thing, pending questions. The model shows that the best intervention to reduce maternal mortality in Honduras in the next 25 years is to increase the education of the girls. This is the theory, the evidence we know. There are some social norms in the poorest communities that limit the decision and the autonomy of women of going to a hospital, and they retain them in their communities, these girls in the community. In the community, not only the women, but also the newborns. And the newborns that are not seen in hospital, the mortality is also very high. And another number of things. But they couldn't do this, and this is normal, is that when there was a topic like this, the change of social norms and education, they haven't made the decision of moving the barriers on going to the Ministry of Education, Ministry of Health, and so on. This is the following stage. But for these kind of things, this type of approaches are very helpful because otherwise they wouldn't have seen it. Who's the most central person in this network, I ask. So we have connection of people. John, he himself has 6 connections. He's a very important person. The literature don't call them champions or change agents. Please remember that John may be resistant to change. So it is important, but he may be your worst enemy. He's a broker. I am a broker. Fred, I work in 5 schools going from one to the other and preparing the projects. And you go and you do it. You have described it. This is a connector. Very important for the flow of knowledge, for the activity, because he is connected to all these people, and also these two here know what he knows, and that can be transmitted to the rest. And these 2 people, Susan and Samuel, are the sensors, are people that do not have many connections. They do not connect, but they have a capacity to take the network and say that they know everything. And in terms of relationships and communication within networks, these people are the 3 players that we have to identify. In India, in a project that it's an ongoing project with the Gates Foundation, there were a lot of interventions in some states that are innovative because they introduced a little first affairs attention cases, but the money from Gates is not enough, not the money for the government, similarly. Because these states are very poor, so the change theory is that if you intervene in these others and create negos connecting to the players, mayors, health workers, and so on, that phenomenon will be, the knowledge will be transmitted, and innovation from these states will be distributed to those poorer states. We had some surveys done, and players that like emails and communications, and they measured the possibility of adopting another text, and which is the possibility of being influenced by the others. So this is the map of the network. Each one of that is a district, very, very large, like the Brazilian ones. And if you see here, these networks are separated, little connection among them. So the strategy that we had in mind wouldn't work unless we had a lot of interactions, face-to-face interaction among them. But look at these two. They are very much connected, and they can merge. And they can get together. Honduras, a very small district that doesn't have administrative capacity, joins others. And I will end up by explaining
las redes sociales para
another application of social network to leave you perhaps some confusion and perhaps some reflection. I have a work of a kind that I have admired all my life. Woody Powell from Stanford. He has been studying during all his life how to set up organizations, but I am interested in him because for many years now he's working in networks, and in Latin America we speak about networks all the time, but I rarely see an analytical study on networks and interorganizational networks in our region. So what I want to show you is how the organizations evolve and how new forms of organization appear. For example, if we are coming from a hierarchical style to another one which is more interactive, what happens at the moment of transition, and which factors lead to that translation so that the new species may survive and replace the old one?
It's in public management. This is why I bring it with a pinch of salt. For example, let's imagine the situation in Colombia. What is the discourse, the prevalent discourse in the public sector, at municipal level, or be it at departmental level, or even in Brazil? What is the prevailing discourse in the organizations of the civil society? Those territories, these discourses are being mapped. And in the case of this study that this man finds, the civil society, for example, there are 400 organizations in the world that do have a certain type of discourses, associative discourse. Scientists have a discourse that people of the management community have administrative or management discourse, but there are very new, fresh organizations that appear in the center, that are the ones that are going to be replacing or going to be creating a new structure in all. And these ones have these three types of competencies. They survive, because they want to call people. This is something we understand. They do proselytism. This is what Paulo said yesterday. This is an activist state. They're engaged with social movements, they engage with the social movements or the social media, and they do strengthening, they train people, so through financing, they create new organizations. Well, this is the map of the networks, and here in yellow, you see the organizations here, and I leave you with this. Until today, in the world, these of social sciences, there is a clash, terrible clash, between those who see social shift as a fight confrontation, and they're on the side of the social media, social movements, versus against the two extremes, those who believe that organizations actually unite around fashion. The fashion today, for example, is integration. Everybody's integrating. But what he finds, and this you can read it in going to leave you with the material, is that for you to consider, you can see the competencies, the focus that they use. You're going to see that governments are here, such as Paulo explained also, as multilateral banks operate, the governments actually operate through coercion. You use these handouts in order to induce to conducts in the local administrations. Going from here to this is a different type of government. And in my opinion, this is my personal opinion, intersectoral action as being defined in this region of the world could go towards this type of activities. You have some indicators in types of organizations. I conclude by saying that still here in the region, from the discourse to measurement, from measurement to outcomes, we still need a few steps to take, but talent is there. I have suggested two methodologies that cannot guarantee if are applicable. But I'd like to hear, especially in the system dynamics, how applicable do you think these models are for you? Thank you very much. End of presentation.